Hi, my name is Cafrey, and I'll be talking about Rexulti, also known as Brexpiprazole. Some of the patient consultation points. Side effects may include hyperglycemia, weight gain, akinesia, headache, somnolence, tremor, nasopharyngitis, dysphagia, constipation, or diarrhea. Second, we want to instruct patients to report worsening depression, suicidal ideation, or unusual changes in behavior. Third point, we want to inform the patient to report symptoms of impulse control disorder, such as gambling, hypersexuality, or compulsive spending, or compulsive eating. Last point is to advise patients to report symptoms of tardive dyskinesia or neuroleptic melanin syndrome. Black box warning. We want to inform elder patients with dementia-related psychosis treated with antipsychotic drugs are at increased risk of death. Rexulti is not approved for treatment of patients with dementia-related psychosis. Also, antidepressants increase the risk of suicidal thoughts and behavior in patients aged 24 years and younger. We want to monitor for any clinical worsening or emergence of suicidal thoughts and behavior. Safety and effectiveness of Rexulti have not been established in pediatric patients with major depressive disorder. Some of the introduction points. Rexulti was FDA approved on July 10th of 2015 and was developed by Otsuka and Lundbeck. Rexulti was first approved for adjunctive treatment for adults with major depressive disorder and adults with schizophrenia. As of March of 2023, there is no generic version of this medication. Now, in terms of the revenue, Lundbeck brought in a revenue of 3,890 millions of Danish crowns, which is about 554 millions of dollars in 2022. Now, in terms of the USL, was about 3,645 millions of Danish crowns, which is about 519 millions of dollars in 2022. The mechanism of action of brexpiprazole in the treatment of major depressive disorder or schizophrenia is unknown. However, the efficacy of brexpiprazole may be mediated through the combination of partial agonist activity at serotonin 5-HT1A and dopamine D2 receptors, and antagonist activity at serotonin 5-HT2A receptors. As of right now, there's two FDA-approved indications. The first one is an adjunct therapy to antidepressants for the treatment of major depressive disorders in adults, and also can be used for treatments of schizophrenia in adults and pediatric patients aged 13 years and older. There's three different dosages that we need to be aware of. The first one would be the major depressive disorder in adults. Starting dose is 0.5 milligrams per day or 1 milligram per day, but the recommended dose that they should be on is 2 milligrams per day, with the maximum dose of 3 milligrams per day. Second point would be schizophrenia adults. Starting dose is 1 milligram per day, with the recommended dose between 2 to 4 milligrams per day, with the maximum dose of 4 milligrams per day. Last but not least, for schizophrenia in pediatrics between 13 to 17 years old. Starting dose is 0.5 milligrams per day, with the recommended dose between 2 to 4 milligrams per day, with the maximum dose of 4 milligrams per day. Contraindication. There's only one contraindication that we should be aware of, which is the known hypersensitivity to Rexulti or any of its components. Adverse events. First one is cerebrovascular adverse reactions in an elderly patient with dementia-related psychosis. Second is neuroleptic melanin syndrome. Third one is tardive dyskinesia. Fourth one is pathological gambling and other compulsive behavior. Fourth one is metabolic changes and leukopenia, neutropenia, and agranulocytosis. Last but not least is orthostatic hypotension and syncope and seizure. Drug interactions. So there's three drug interactions that we should be aware of. First one is strong CYP3A4 inhibitors, such as clarithromycin, ditizem, ketoconazole, and ritonavir. Second is strong CYP3A4 inducers, such as phenobarbital, phenytoin, rifampicin, St. John's wort, and glucocorticoids. Third one is strong CYP2D6 inhibitor, and these can be bupropion, fluoxetine, paroxetine, quinidine, and terbinafine. Now I'm going to talk about drug interaction dose adjustment. So there's four factors I want to mention about some dosage adjustment. The first one is strong CYP2D6 or CYP3A4 inhibitors. We want to administer half of the usual dose. Second point will be strong to moderate CYP2D6 with strong to moderate CYP3A4 inhibitors. We want to administer a quarter of usual dose. Third point will be known CYP2D6 pore metabolizer taking a strong to moderate CYP3A4 inhibitors. We want to administer a quarter of usual dose. Last but not least, strong CYP3A4 inducer. We want to double the usual dose and further adjust based on clinical response. Now, on the asterisk, Rexulti may be administered without dosage adjustment in patients with major depressive disorder when administered with strong CYP2D6 inhibitors such as paroxetine or fluoxetine or etc.